everyone, welcome back to our channel. I'm Dr. Amel from City Skin Clinic, and today we're going to have a chat about keratosis pilaris. This is a really common skin condition that often looks like goosebumps or chicken skin, and it is something that is, like I said, quite common. We can treat it quite easily, so I'm just going to go through what it is, who's more susceptible to it, and what you can do at home to treat this condition and kind of keep it at bay. Before I can continue, don't forget, if you're new to our channel, don't forget to subscribe and hit the notification bell so that you can be notified when our next videos appear. If you're a returning visitor, welcome back. It's great to see you. So, what is keratosis pilaris? Well, this is a skin condition and it basically gives rise to goosebumps. In some people it may look like little pimples, and these are generally visible throughout the skin. It's most commonly seen on the arms and on the thighs, but could also be in children, visible on the cheeks. And these little bumps are often described as looking like goosebumps or plucked chicken skin. And for many people, it's something that they are quite self-conscious about, and they don't like it. It often is first noticeable either in childhood or when people are teenagers, and it's something that can continue on. Like I mentioned, this is a harmless skin condition, but a lot of people dislike it mostly because of the appearance of the skin. It's something that is not impossible to treat, but it does need a little understanding about the process and what are the best skin products to look for. It can affect all kind of skin tones and all sorts of people. There isn't really a well-known cause of it. So what we do know is that the skin ends up getting these kind of goosebump appearance because hair follicles get clogged up by keratin and dead skin cells. So whilst there isn't really a cause of it, we do know that people with the following conditions are more likely to get it. So people who suffer from eczema and dermatitis may have this. People with dry skin may have this. There are certain medications, including one that treats melanoma, a very horrible skin cancer, that can give also rise as a side effect of keratosis pilaris. If someone in your family has it, you are more likely to have it. But beyond that, there isn't a specific cause, and some people just have it and they don't have any medical problems, and not on any medications, and they don't have anyone in the family who suffers it. The thing with keratosis pilaris is firstly to check that this is indeed keratosis pilaris. So if you've suddenly developed this condition, or if you have a child or a teenager who suddenly developed it, it's important to firstly make sure that it's not anything else. And the best way to do that is go visit your doctor and just make sure that that's what it is. Normally the diagnosis is usually just done by looking at it, so someone can use their expert kind of eye and have a look. There's usually no tests required unless there's a suspicion it's something else. So it's quite an easy diagnosis to make if you know what you're looking for. Once you know that what you have is keratosis pilaris, how do you treat it? Well, firstly, we know that the problem is hair follicles getting clogged up by dead skin cells and keratin. So the first thing that you need to do is find a way to exfoliate dead skin cells. Now, here's the thing with keratosis pilaris. You cannot be too aggressive with your skin. So being very aggressive with the skin leads to the condition being worse. So when I say exfoliating the skin, I don't mean kind of rough sort of exfoliants. I don't mean physical exfoliants that might cause micro tears. What I'm talking about, the most effective way, is actually using creams and lotions that have acid exfoliants in them. So the best type would be glycolic acid, or look for something that has salicylic acid if your skin is on the oilier side. You can also look for something that has lactic acid, urea, These are really good for kind of gently exfoliating, so softening the skin and exfoliating it, and on the plus side they make the skin smoother as well. So find an exfoliant, so that's usually a lotion that has these in them. The other thing that's also important is to prevent them from getting clogged up again, and one way to also do this is use a lotion or a cream that has vitamin A in it. We know vitamin A is good at stopping skin follicles from getting clogged up. We use it often in the treatment of acne, and it's really good to use it in keratosis pilaris. So this could be something that contains retinol if you're looking over the counter, or prescription retinoids if you are going down that route. So that's what we're going to do in terms of the exfoliating side of things. Also, when you're washing your skin, avoid things that dry out the skin. So do not wash your skin with a bar of soap, because that's going to dry it out. Look for a gentle cleanser that is just going to wash your skin but not dry it out. And there are plenty of really good cleansers like this, body washes. So Aveeno have a really good range that helps with dry skin, but there's so many. So look for a gentle cleanser like this. You can use a soft kind of loofah or a poof or a flannel if you want to wash your skin, and gently kind of rub it over the skin, but don't vigorously try and scrub your skin away. That's going to make the keratosis pilaris worse. So that's the first thing that you do. Then the other thing that you really need to avoid doing, so we know that kind of if you soak in the bath for a really, really long time, if you take really, really long showers, that can strip the skin of oil, it can irritate it, and it can dry it out, and it can worsen the keratosis pilaris. So again, keep, for both your skin's sake and the environment, keep your showers to a reasonable time. And so once you have gently cleansed your skin and you're out of the shower or the bath, then moisturize. Use a really thick emoliating moisturizer. The ingredients to look for keratosis pilaris are things that contain glycerol or petroleum jelly, so things that are really meant for super dry skin. Eucerin is a really good brand that provides really good kind of products for that type of skin. But there's so many, and I'm happy to provide recommendations in the comments below this video. It's not about the brand, it's what's in the ingredients. You want to, as soon as you've gently dried your skin, apply this so that you can seal in the moisture and prevent the skin from drying out, which worsens the keratosis pilaris. So you apply your lotion or moisturizer. You need to apply this moisturizer at least 2 to 3 times a day, so definitely after you've left the shower, but you want to keep your skin moisturized. You want to reduce the amount of moisture loss from the skin, because that is what's keeping the keratosis pilaris going. Now, I mentioned that you want to also use an exfoliant in a lotion. So the exfoliant ingredients could either be in your moisturizer, or you can have a separate lotion with the exfoliating ingredients, and you can apply that. I usually would say the best time at night is to apply the exfoliant lotion. And then avoid any aggravating factors. So you've got your skincare routines. We're going to use a body wash or a shower gel that is not going to have alcohol, it's not going to strip the skin and dry it out. So we're going to use something that's designed for really dry skin. Then we're going to gently dry the skin, and then we're going to put a moisturizer that's really thick, that's emoliating, that's going to keep the moisture in. And like we mentioned, that moisturizer can have your alpha hydroxy acid, glycolic acid, your lactic acid, whatever ingredients that I mentioned that would be good for exfoliating, or it can be separate. I personally like having it separate in a lotion and just using it at night, but some people aren't good with too many products. So if you're someone who just wants one product that you can use, then find a product that has that. And then you're going to use your moisturizer 2 to 3 times a day to just really keep the moisture locked in. What you're also going to do is avoid irritating your skin. So that means not wearing clothes that chafe against the area that has the keratosis pilaris, because that roughens and thickens the skin and makes the condition worse. You're also going to have a look at some of the things that you do. So for example, if you are someone who uses hair removal in the areas that have keratosis pilaris, so for example your thighs or wherever, and that's something that you need to think about. So sometimes shaving and waxing can make this worse, particularly shaving. So you may want to consider stop shaving for a period if you can, or maybe consider in the long term something like laser hair removal to avoid that constant irritation. So that's kind of the main background behind keratosis pilaris. I hope you found it useful. It is something that is not difficult to treat, but it requires persistence. We're talking about, you know, weeks and months of sticking to a routine, of making sure you change habits that irritate the skin. And when I say a routine, this is not that difficult in terms of, you know, the cleanser, you use something to wash yourself with every day anyway. The addition is just really the lotion and moisturizer, or just a moisturizer that contains the exfoliating ingredients that I mentioned. That's the chief kind of trick to it. Now, if despite all of this the condition isn't improving, or it's improving but too slowly, you may have to consider going and seeking a dermatologist or someone that specializes in treating this problem and getting stronger products with a prescription. I would recommend, if the condition is just manageable, it's worth trying at first, you know, using at-home skin products that can be purchased from the drugstore or any reputable skin collection, because these can really help. Remember, start off by confirming that this is keratosis pilaris and it's not some other skin problem that actually needs medical treatment from the beginning. Once you've confirmed that, have a go and try these to try and improve it. Anyway, if you're someone who has keratosis pilaris and you've tried products that have worked or haven't worked, please leave a comment below, share your experience. It's always really great for us and our community to kind of find out what people think. And also, if you have tried any prescription products, what your experience would be with these. I'd love to hear from you. If you have any questions about this or any skin conditions or aesthetic problems, please leave a comment and I will do my best to answer it. I will also leave some useful links from the British and the American Dermatology Associations with a bit more information about keratosis pilaris, the science behind it, and the science behind why certain treatments and products work. That's it for now. Please don't forget to give this video a thumbs up. Don't forget to subscribe to our channel, ring the notification bell. Until next time, stay beautiful.